Erectile dysfunction in your 20s. Common causes and what to do. For many men, reaching their 20s signifies a time of immense confidence, vigor, and sexuality. However, an alarming number of younger guys are experiencing erectile dysfunction, ED, well before they ever expected to. In fact, it is estimated that approximately 1 in 10 men, ages 18 to 24, experience some form of ED, and those numbers climb to 1 in 4 by ages 25 to 29. While ED was traditionally viewed as an older man's problem, it is certainly just as prevalent among younger males as well. What's causing so many guys in their prime dating years to struggle with inability to achieve or sustain erections? There are numerous potential physiological and psychological explanations. Addressing and treating the underlying drivers of ED early is important for long-term sexual health and well-being. Physical risk factors. On the physical side, certain chronic health issues are emerging at younger ages, putting 20-somethings at increased risk. Diabetes and obesity. The obesity epidemic has caused type 2 diabetes diagnosis in those under 30 to skyrocket. Both diabetes and severe weight issues impair circulation. High blood pressure. Studies show 20% of American men aged 20 to 39 have blood pressure over 140/90ths, constituting prehypertension or worse. Testosterone deficiency, more common than realized. Low T levels in youth stem from poor diet, lifestyle lowering natural production. Illicit drug use. Recreational drugs like cocaine, ecstasy, and marijuana are linked to vascular and hormonal impacts that disrupt erectile function. Prescription medications. Antidepressants and blood pressure meds are commonly prescribed, but a recognized side effect is hampering erectile pathways. Prior injuries, pelvic fractures from accidents, and even intense cycling riding have been tied to nerve damage, causing lifelong ED for some younger men. Psychological factors. Stress, anxiety, and depression are at an all-time high among youth and strongly correlate to increased reports of ED. Performance anxiety. The pressure to perform leads to distress spirals that then lead to actual sexual problems through a self-fulfilling cycle. Porn addiction. Excessive masturbation to pornography versus real partners can rewire dopamine responses in the brain, impairing real intimacy. Low self-esteem. Issues with body image, past rejections. Comparing to peers normalize temporary states of low confidence, sabotaging arousal. Childhood trauma. Adverse experiences like abuse unfortunately manifest sexually later on through mental blocks on intimacy. OCD. Bipolar disorder. Psychological disorders left untreated sometimes cause associated sexual dysfunction among younger demographics as well. Managing erectile dysfunction in your 20s. For guys experiencing ongoing ED in their 20s, it's important to take the issue seriously but not panic. Starting with your primary care doctor is wise to check for and potentially address underlying physical causes through basic testing and lifestyle adjustments. For example, optimizing blood sugar pressure control through dietary changes and exercising regularly, or changing certain medication regimens may itself resolve ED symptoms. Supplements like L-arginine and maca root are also emerging as natural options for boosting vascular and hormonal health with minimal risk. For psychogenic cases, acknowledging stresses openly to trusted friends/partners can relieve pressure to perform. Cognitive behavioral therapy techniques help shift anxiety spirals to being fully present and comfortable during intimacy versus outcome-oriented. If lifestyle shifts alone don't work, oral PDE5 inhibitors like Viagra, Cialis, and Stendra specifically treat the inability to achieve erections. With a prescription, they allow most men to regain confidence intimately while addressing the root issues simultaneously for a permanent solution over the long haul. Getting to the underlying drivers of ED as early as possible sets men up for decades of active sexual functioning and relationships down the road. Don't let toxic shame prevent seeking help. Your 20s are meant for discovery, pleasure, and building intimacy skills for a lifetime. With patience and consistency, regaining and maintaining robust erections is very achievable. The takeaway is that erectile dysfunction can indeed affect younger men for both physical and emotional reasons. However, the root causes are usually highly treatable if addressed promptly versus ignoring the issue long term. Staying proactive about sexual wellness paves the way for maximum enjoyment during one's prime dating years and beyond. Thank you so much for watching. See you in my next video.